Good afternoon and good morning, everyone. Welcome to 2022 and the first PQA Quality Forum webinar of the year. My name is Amanda Ryan and I am Director of Education here at PQA. We are very excited today to introduce to you the newly released PQA Social Determinants of Health Resource Guide and to feature an initiative contained in the guide that was conducted by CVS Health. We will get into all of that in more detail in just a moment, in a few minutes also, but first, I would like to walk you through some housekeeping details. First, please submit your questions during the presentation. You can use the Q&A feature that is at the bottom of your screen in Zoom. We will have an extended discussion as part of the webinar today. Also, as usual, the webinar recording and the slide deck will be available to PQA members within the week following the presentation, and that will be in the member resources section of the PQA website. And then finally, I would like to encourage everyone to please complete the quick 1-minute survey that will launch at the end of the webinar today. We do value your feedback, and we use that feedback to build future Quality Forum webinars. With that, it's now my pleasure to introduce you to today's speakers. First, we have Alexis Caronis, who is PQA's 9th Executive Fellow. Alexis graduated with her PharmD from the University of South Carolina College of Pharmacy in 2021. During her time at PQA, she has been involved with many of our educational initiatives, including the Medication Use Quality CE program, our student and professional programs, and the SDOH Resource Guide. Alexis has overseen the identification and the documentation of initiatives contained within the guide and has facilitated the design and the launch of the guide. Also with us is Arpana Mathur, who is an executive medical director at CVS Health, where she leads a team of physicians and pharmacists dedicating to ensuring high quality, safe, and equitable clinical programs and services for millions of its members. She has led projects to understand disparities in chronic condition care, develop innovative pharmacy-based initiatives to close gaps, drive high-quality clinical outcomes while actively managing costs for specialty medications, and conceptualized and implemented quality improvement of clinical programs. Prior to joining CVS Health, she has 2 decades of experience as a family physician in various practice settings, including a residency program, federally qualified health center, and multi-specialty group practice caring for patients. And finally, RJ Bricione leads the Social Determinants of Health team for CVS Health, scaling SDOH strategy across the CVS Health enterprise for all lines of CVS and Aetna business in support of the company's Destination Health platform to focus on community health and address social determinant gaps. Prior to this role, he led medication business development for Aetna's East region, leading teams in all stages of proposal response for multi-year Medicaid managed care contracts. He joined Aetna in 2016, bringing more than 10 years of experience in healthcare services for government programs, as well as large-scale management of political campaigns. Prior to joining Aetna, he served as Director of Medicaid and Duals Operations in multiple states for Anthem, Inc. He holds a BS in Aeronautics from Embry-Riddle Aeronautical University. Thank you to all 3 of you for joining us for this discussion today. And with that, I will turn the floor over to Alexis.
Thanks, Amanda. The PQA Social Determinants of Health, or SDOH Resource Guide, documents real-world SDOH services that are promising for improving the quality and safety of medication use. We believe this is the first resource guide that catalogs pharmacist and pharmacy-centered SDOH services. Embedded in the community as the most accessible healthcare providers, pharmacists are uniquely positioned to connect individuals to SDOH resources. The guide is designed for healthcare professionals working in a variety of settings across our care system. Our goal is to provide them with a centralized source of ideas and examples of SDOH services they can implement in different settings, in partnership with pharmacists, pharmacies, and others. The guide contains 20 ideas and examples of SDOH services from across the nation. Whether you're working for a health plan, pharmacy, health system, community organization, public agency, or other provider, the guide has useful insights for starting or enhancing SDOH services. Please note specific instructions and links to access the guide will be provided later. The first edition of the guide focuses primarily on cost of medications, cultural or literacy barriers, and screening for unmet needs, as all three areas were identified by PQA membership during the 2020 Leadership Summit, as both areas that pharmacists or pharmacies are able to impact and areas that PQA members are currently screening, referring, or intervening on. As we were identifying examples, most initiatives, as you would expect, address multiple barriers, as individuals who struggle with SDOH commonly face challenges in multiple areas. In the future, PQA will proactively seek examples across all of the 7 areas listed on the screen. And in the guide, the SDOH barriers addressed are listed for each initiative. Next slide. Those 7 barriers are addressed across 3 primary types of SDOH services: screening for unmet needs, referrals, and interventions. Many of the initiatives featured multiple approaches to addressing SDOH, and in the examples that we've cataloged, screening and referral are the most common services, but often they're paired with each other or with interventions. While we focus primarily on the cost of medications, cultural or literacy barriers, and screening for unmet needs, this chart demonstrates that these initiatives address all of the SDOH barriers. The most common are cultural or literacy barriers, screening for unmet needs, and transportation. Like the type of service, each initiative may address more than one barrier. Half of the initiatives included have been implemented in a community pharmacy setting, followed by health system and health plan. The other healthcare settings include a barber shop and a primary care clinic. Specific settings are provided for each initiative. Additionally, 50% of the initiatives were conducted at the local level, followed by 25% at the national level and 20% at the state level. While each initiative is unique, we have worked to summarize common information across them so that you can easily see the what, where, and how of each example. Underneath the initiative name is a list of the organizations involved, followed by keywords. Then type of service, a brief description, key takeaway, SDOH areas addressed, setting, scale, location, and target population. On the second page of each initiative, intervention details are provided, and if available, outcomes and results have been provided. And lastly, PQA has provided the resources we've utilized, all of which are hyperlinked. We recognize that healthcare professionals working to address SDOH have specific needs and interests that track to their practice and the populations they serve. So we've created an appendix that documents a host of characteristics and subcategories for these initiatives. Titles for the categories are provided on the left side of the screen. Additional characteristics include things such as diabetes, hypertension, adherence, and telehealth. The screenshot on the right of the slide demonstrates that the categories are listed in orange and subcategories are italicized. Specific instructions on how to access the guide will be provided after we hear from CVS about their HealthTag initiative. And now I will hand it over to Arpana.
Thank you, Alexis. Really appreciate the opportunity to be here and talk a little bit about CVS Health's commitment to health equity and our initiatives around this very, very important issue. We'll go on to the next slide. So, you know, CVS Health has made a $600 million commitment to social justice and equity. In July of 2020, CVS Health formalized a multi-year pledge to address and advance social justice and equity in the Black and African American communities and other historically disenfranchised communities across the nation. And this work is really fundamental to realizing our purpose of bringing heart to every moment in health. Our commitment is also, you can see it in our mission statement. This commitment is through 4 of our pillars. It's through our colleagues, it's through our communities, and it's also via public policy. So I'll briefly touch upon each of these. So in terms of colleagues, we are committed to providing equal opportunity for all employees striving for a diverse workforce. Really this commitment starts at home for us. And this reflects in the communities we serve. So some of the initiatives that we've embarked on is conscious inclusion, anti-racism training to all of our 300,000 colleagues, targeted professional development, community-based hiring, extended university relations. Then the biggest and the most important piece, especially that we want to talk about here, is our community-based approach. So here we're really talking about strengthening our community relationships, right, to benefit those who are historically disenfranchised and provide that level of support. So to that purpose, we've really done free biometric screenings. Our mission and our approach has been very hyper-local, and we have hyper-local strategies to facilitate both COVID-19 testing and vaccine equity, affordable housing investments in ensuring transportation to appointments, increase investments in supplier diversity. So those are the initiatives which are leveraging on our community partnerships, and we will talk a little bit more about that when my colleague RJ takes over the next section of the presentation. And then last but not the least is public policy. That's really also very key. We've been advocating for public policy using our CVS Health voice and resources. We are committed to effecting this change through extensive employee education, legislative advocacy, and then publication of the CVS Health standalone strategic diversity management and EEO1 reports. So again, this is our commitment. It's visible in our mission statement, and we really put the full force of the enterprise behind this. To put in lay terms, we really put our money where our mouth is. We'll advance to the next slide. In this slide, I just want to touch upon some of the social determinants of health community indices. We know, and there's been a lot of talk about this, SDOH are conditions in which people are born, they grow, they live, they work, and they age. I was just in a meeting before this, and we have to keep reminding ourselves of really what we're trying to deal with here. So we've examined 17 indices, and they're on the right hand of the slide. So they're anywhere from health habits, access, disabilities, citizenship, education, isolation, housing deserts, food deserts, and so on and so forth. And then based on those, we at CBS are focusing on the following 6, and I'll briefly just walk you through these and going in clockwise directions. So health access, that's a composite score that we've developed based on the population with health insurance and undergoing screening, regular health screening. Second is the index of food access, and here this is based upon this for urban areas, where a percentage of people beyond 1 mile of a supermarket, and for rural areas, percentage of people beyond 10 miles of a supermarket. Then is employment, so percentage of labor force employed in the community, economic conditions, so the composite score based on the income levels and population on food stamps, education, so this is a composite score based on population with different levels of education, such as high school or postgraduate. And then health infrastructure. So this is a composite score based on providers per 1,000 population ratio, infant mortality rate, substance abuse prevalence, and travel time to the nearest source of care. So we've really decided to focus on these 6 indices, which we feel really covers a gamut of aspects which are impacting our underrepresented minorities. We'll advance to the next slide, please. In the next slide, I want to just sort of briefly talk about, we focused on health equity and sort of what are our guiding principles. Our guiding principles are really 4. And I'll go into each one of them in a little bit of detail, just to sort of help you understand how we're approaching this. So first, we want to talk about championing education awareness. And what does that mean? That really means providing culturally appropriate education. That's the key here for condition management. And then to do that, how are we going about that? We are partnering with community-based organizations. We're partnering with patient advocacy groups and health systems to deliver care. So it's sort of a full wraparound strategy to engage with the vulnerable populations, whether it's through physicians, patient support groups, health systems, academic centers, all of that. So that's our efforts behind championing education and awareness. The second, and again, really important, I'm a primary care healthcare provider by training, so this is really close to me and my heart, is increasing community testing and screening. And I can't talk enough about this because we know that impacting care and improving outcomes, for that, we first have to identify at-risk communities and work in conjunction with our clients and partners to increase access to testing and screening. And we're really focusing first on 3 conditions: that's sickle cell, HIV, and cardiovascular disease. So, that's our second principle there. Third, so once you identify these patients and population which needs this care, how do you simplify the access to care? So that's really our biggest focus too, where we're leveraging all of CVS Health assets across the nation to make it easier for populations facing health disparities and have good access to care. And then lastly, and even furthermore important, sort of keeps building one upon the other, is the optimization of treatment interventions with data. So we're really building an enterprise-wide SDOH data set to identify the channel mixes. We're looking at developing enterprise-wide member indices to address and monitor these health outcomes for vulnerable populations, measure, and then share the results for continuous learning. So, that's really key, and especially for PQA, I know we always talk about measurement, and that measurement and the results of that informing the next process in terms of quality improvement. So our 4 principles in achieving these health equity, I think it sort of covers in the right way and in a systematic fashion, where you're going from education, awareness, identification, improving access, and finally optimization of treatment. We'll advance to the next slide. In here, I just want to briefly touch upon, one of our models, we have a huge pharmacy-based presence. We have a lot of assets across the nation at CVS Health. So how are we using those to address and engage with our membership? So first off, just a little bit of epidemiology, if you will, on cardiovascular disease, sickle cell, and HIV before we get into this slide. So we know that for cardiovascular disease, 32% of African-American patients are more likely to die from cardiovascular disease. 70% of more infections for HIV are more in Latinx and Black individuals. And then similarly, for sickle cell, adults with sickle cell disease have 12 times more emergency room visits pain crisis. So we don't just, it sort of tells us the breadth of the impact of these 3 diseases that we are first focusing on, and then we'll touch a little bit on how we are using our community partnerships, particularly on the pharmacy side, to engage with members and help tackle some of these. So here, one of our differentiating factors for us is that we are able to leverage our existing relationship with patients, right? And patients often, multiple surveys have shown this, patients trust their pharmacist. Sometimes they trust their pharmacist the most as the most trusting healthcare provider. So we want to build on that trust and understanding and continue to leverage that as we move forward. So we use this core differentiating ability and develop a suite of capabilities to help reach patients at the right time with the right message, to help them manage their health, lifestyle, and also achieve access to other resources which are impacting their care. So whether it's automated text messaging, live call outreach to guide patients, face-to-face interactions with the pharmacist, or messages, or other action plans and reminders. So there's a whole host of opportunities that we have within our pharmacy space, leveraging our really talented pharmacists and our frontline stores who are engaging with our membership in multiple ways to achieve those 4 principles that we talked about, which was education, awareness, identification, and optimization. So I'm going to go ahead and turn it over to RJ, who led a very key initiative that we're here to talk about, has also been referenced in the SDOH Resource Guide which is being released by PQA. RJ, I'll turn it over to you.
Great. Yeah, thanks so much, Arpana. Appreciate it. Thanks to PQA for having me. Appreciate the opportunity to talk about this. So first off, just Unite Us, just to level set for those of you that may not be aware, Unite Us is a very interesting, somewhat unique, newish, at least, early stage company that creates networks of community-based organizations for referrals. And they do a whole lot more than that. And I would encourage you to kind of check into them if you're interested. So either as a disclosure or an endorsement, CVS is actually an early investor in Unite Us. And we can go ahead and flip to the next slide, please. So just to sort of back up how we got to this is that I lead the social determinants work, as was said in the intro, for the company, but there's thousands of people within the company that are super interested in really getting to the root causes of health. And so we really are taking an enterprise approach as to how we approach SDOH. So enterprise for us means all of CVS, all of Aetna. How can we use our unique position to make an impact through that local reach and scale of our business? So at the beginning, we really wanted to brainstorm how each piece of CVS could take this partnership with Unite Us. And it's really not just a partnership with Unite Us. They provide us the platform. But I think there was a question earlier when you're panelists, there's all sorts of dings and well, bells and whistles going off. But I did see one of the preview questions before I started talking was, is this with community-based organizations? What Unite Us allows us to do is to scale partnerships with community-based organizations like we never had before. They create this network. So we're talking specifically today about in Louisiana and West Virginia, two places that we really thought off the bat could benefit from this network. And the way it works is we sponsor the network. Unite Us goes out and procures provides the software for free to community-based organizations. And then we are able to, via our either care managers or other inputs at the stores, create referrals to that social network in what our favorite term is as a closed loop, right? So we're able to know about outcomes of on the social side for the first time, which is super unique. And we really wanted to get everybody involved from retail pharmacy to health hubs to obviously all of Aetna. This was based in Aetna Medicaid to start. And so I cannot take credit for leading the HealthTag portion of it. There's a super talented team in our retail, what's called Next Best Action team. And so I'm here standing on their shoulders today. But really, we truly believe that health is local. So our social determinants work focuses on meeting people where they are, to the point of putting these networks in places like Louisiana and West Virginia. And we realize that no two communities are alike. And really, when we think about trying to make it simple, do people have access to food, housing, transportation, care, and realizing that those factors can be just as important to people's overall health. And we really know this can directly affect their overall outcomes. So this is our first pass at it. I'll talk when we get towards the end about where we think we're going to go next. This is a lot of work for those of you who might be contemplating doing something like this. You probably realize just the few minutes we'll spend here on it. This took quite a while to get to this. But our HealthTag program enables, in short, a message to be printed on the bag. We'll have an example of that in a minute. And it creates for the pharmacy tech to have a conversation with the member and point out what's on the bag tag there. So we use some of the data and the information that Arpana showed earlier. And we know that an Aetna Medicaid patient is filling at an in-scope store. So somewhat importantly, or this might answer a question, what was the in-scope? Were 32 CVS stores in Louisiana, 15 stores in West Virginia. That represents overall the number of Aetna Medicaid members that fill at those stores, about 2,500 in Louisiana and about 9,000 in West Virginia. That's the whole kind of addressable market, just to kind of answer a question. So that CVS will get that list of those Medicaid patients and fills in that bag, what's called the bag tag campaign. So as the patient comes in the store, to pick up their prescription. The pharmacy tech calls attention to the message on the tag. We'll show you what that is in a minute, and it's very character limited. It was almost like what you could fit in a tweet about what that means to be if the patient or member needs help with referrals to social services, and it gives them the opportunity to call their member services number. Then our member services staff were trained on how to enroll the members into what we call, it was originally called Destination Health, and we changed the name to Local Works, which is the kind of broader look at the Unite Us networks and other social determinant work across the country. I think we go to the next slide. So here's what the tag looks like. Probably looks familiar to many of you. Obviously all the information on the one side, on the left side, and then it says your pharmacist has important information regarding your health and wellness. The message is on the back. The pharmacy tech would kind of draw attention to this. It has a different, kind of a unique call out. And then this is what we came up with. This is the character limit here. So Aetna and CVS understand that not all of your needs can be addressed in a doctor's office. Our Local Works program is designed to improve you and your family's well-being, and gave some examples of those social determinants and the number to call. So you see the number here, 4,175 members for the length of the run were prompted and received that message. And then we can go to the next slide. It tells a little bit about how that's done here. But this is the total number of members that received the message. So, Arpana mentioned, like, we're always measuring. We always want to measure and then kind of improve on what we can do. So the next phase of this, and we originally thought about doing this for the first phase, but we figured, this was much easier to bring to market, much quicker to bring to market. But what we really learned from that, including the team did a fantastic job of this, including interviews. They were able to call through and interview some of the patients, both that went through and went ahead and enrolled in the program, or at least called for more information on that. But and then those that didn't, and if they remembered seeing it, right? And so as you might imagine, like, a lot of things going on, everybody's busy. People are kind of used to seeing those prescription bag tags. The bag tags were not like they didn't draw enough attention, basically, to get that member to take the action. And so the next phase of this will bring that interaction in a much more active conversational way in store with either the pharmacist and also in our health hubs, with a member of the team there that's really designed to have these kinds of interactions and just kind of take the time to talk to members and patients about what's going on in their lives and how that can be helpful, and sign them up right there. That asking that patient to do that extra step, did not give us a really high take-up rate. And so that's what we're going to do next. So we're excited about the next opportunity to do this and to be able to bring these networks to more patients. So I think we'll roll into questions there, and I'll hand it back to Alexis.
Thank you so much. So now it is time to go over the instructions to access the guide. So this resource guide is located on PQA's SDOH Resource Guide webpage, and then you would scroll to the bottom and see this. PQA does recommend selecting the icon in the bottom right corner to enable the full screen reading mode. However, you can read this as a PDF, and so to do so, you would select the button in the top left corner, and that will download it as a PDF. And then you can share this guide with anyone. It is a publicly available guide, and we encourage you to share it with others. To do so, you can select the share button in the top right corner. That will populate a link to the Issue Magazine platform where this resource guide is housed, or you can simply give them the link to this webpage so they can have all of the information regarding it. To help aid you share it even further, if you would like to share this on social media, there is a social media toolkit on this web page that contains sample language, tweets, and even social media images to help you do that. Next slide. So once you flip past the cover page, this is what the resource guide looks like. So you'll notice the full screen viewing mode is still in the bottom right, but share has been moved to the bottom left and download becomes in the middle of the bottom. And so PQA hopes that this guide will allow stakeholders to adapt an intervention to another pharmacy setting or geographic location, use parts of multiple interventions to make a new intervention, or to use a single intervention as the starting point for creating a brand new intervention in their practice setting. We hope it is both a showcase of what's being done now and inspiration for growth and expansion in the future. Next slide. PQA will continue to expand the guide and plans to issue a second edition within a year that features additional examples plus updates for some of the projects already featured in the guide, as many of these projects are in progress and will report results in the future. The first edition of this guide features 20 examples, but we know there are dozens of others out there, and we're actively working to identify and summarize those for inclusion. Adding to the guide's depth is a priority for PQA. The QR code on the screen will navigate you to PQA's SDOH Resource Guide webpage, and we've provided the link to the webpage in the chat. We would love to hear specifically how people are utilizing this guide. You can provide feedback to us anytime at education@pqaalliance.org. And if you're on the webpage, there's a button that says provide feedback and will prompt you to send us an email. Additionally, if you have an initiative that's already been included and would like to provide us an update to that, you can do so by emailing us at education@pqaalliance.org. And if you're working on an SDOH initiative that PQA can consider for inclusion in the guide, we have a form that is linked in these slides, also linked on the webpage, and should be in the chat box momentarily. So this activity was supported by an independent medical education grant from Merck & Co. and by Humana, whose mission is to help people achieve lifelong well-being. And now I will turn it over to Amanda for questions.
All right, thank you, Alexis. Thank you, Arpana and RJ, for describing not only PQA's SDOH resource guide, but also all the great work that CVS Health is doing to address SDOH. So questions are rolling in here in the question and answer portion of Zoom. So please do feel free to keep those coming as we have our discussion here. I'm going to start a question out with RJ, and this is kind of a combination of a couple of questions that came in. We have some interest in finding out what CVS Health is doing to expand access to care to minorities specifically. And so on top of that, what efforts does CVS Health have underway in supporting vaccine distribution across different populations?
Yeah, sure. I'll flip the first half back to Arpana maybe to get a holistic addressment, but I'll go ahead with the Vaccine Equity Access Project because I and many others, I'll feedback there. I and many others in the company basically dropped everything we were doing at the beginning of last year to really focus on vaccine equity access. So a couple prongs it took. One was, I'm still getting the feedback, sorry. One was store selection, which is we really looked at the average social vulnerability index for stores, and probably to level set, if everybody can think back to a time where vaccines weren't readily available and people really wanted to get to them. I know that's kind of hard to think of right now, but this is what we were going for, trying to get them to Black and brown communities as quickly and as frequently as we could. And so really first piece was store selection. So looking at that average social vulnerability index, and we got that to stores. The average SVI for those stores that we activated early was a 0.52 compared to a 0.45 for all of CVS stores nationally. The second thing we did, which was a tremendous lift, but well worth it, was what we call an equity phone line. So we partnered with, we took all of the organizations that both Aetna and CVS partner with in communities on the ground. So Feeding America, Black church associations and pastor associations, kind of you name it, of community organizations that were on the ground, that were our identified partners. And we gave them the communications to bring out to their membership. So super, super important when you think about vaccine hesitancy, right? The message was coming from their pastor, from their church, from that organization that they're a part of, not from CVS Health, right? And we made sure that they were, this was when everybody was clamoring, and people, I remember seeing pictures on Twitter with people with 6 and 7 devices trying to get the vaccine booking, right? We realized, we knew somewhat ahead of time we were going to have that problem. We realized really early on that problem was happening sort of on a scale that we weren't quite ready for. But we were able to reserve the specific phone lines for those groups, get them a specific number to call and get their appointments for their very either local CVS or the next thing we're going to talk about, which is community clinics and pop-ups. So going back to the trust factor, not every CVS is in the perfect location for these communities that we want to serve. So we partnered with, again, local organizations, kind of anybody who was interested and who we had a channel to get to, in lots of different areas. The first couple were, well, if I tried to do it justice, I wouldn't do it justice, but kind of all your major cities and getting really inside those cities where we know the community need was. And so it was a very small van, the CVS Health vans that we purchased just for this opportunity, partnered with those community organizations, and we're able to do that, not where CVS's were, but where the community actually is. And then the final piece of that, really one of my favorite learnings from my work and being 2.5 years into doing only this, but 10, 12 years of doing this for Medicaid members, is that if you try to address, and you mentioned this really well, Alexis, in the intro to the guide, right? There's no point in trying to address a single social determinant, right? So if we're bringing vaccines to people inside the community, we probably need to get them to and from there. I've seen the same thing with some of the food work that we've done, right? I see people leaving from food distributions trying to carry this food kind of on their bodies, right? Where they don't have cars and they don't have vehicles. So transportation access, we partnered with Lyft to use free and discounted ride vouchers to and from those clinics, and partner with the YMCA as well, where they were having vaccine clinics. So probably the work in my career that I'm most proud of. It seems like this tiny little point in time now where it was really hard to get vaccines and we really wanted to get them to that community, but all out effort all the way across the company. And then the front piece of that question, I might kick to my colleague here.
Thank you, RJ. Vaccine is front and center at this point, but testing still stays as important. So it was really, we know that African-American and other disenfranchised groups of Black and Brown communities have always had a very high burden of disease. But COVID-19, the pandemic, really did put a spotlight on disparities suffered by these communities. So the data now shows that the Latin community, for example, makes up 18% of the population, but was the death rate was about 34% from COVID-19 cases. When the COVID-19 hospitalization cases, the Latinx community was about 34%. Similarly, for African Americans, they were dying at a rate of 2.4 times more than the Caucasian population. So the pandemic really did put a spotlight on the health disparities and equities, as well as the disease burden. So CVS, in their response, they took into consideration, and I already just talked about it, we overlaid our SDOH indices on top of the CDC risk score. And this was in a couple different ways that came into place. So number one was testing. You know, now it seems sort of so far back, but way back in 2020, it's sort of hard to even think of this anymore. It was COVID-19, we're 2 years out, we're still dealing with this, right? So at that point, if you remember, people could not get testing, and particularly for these underrepresented minorities and hard-hit communities, it was even harder. So therein, CVS did a huge effort on community-based testing. So in the beginning, this was sort of taking testing to where the people are, especially patients were high Black and Hispanic residents in those communities. So we're working with organizations at the grassroots level, and it started out with 12 community-based testing centers in 8 states, expanded to 18 community-based testing centers. And if I think last I checked in the report, we're still operating about 9 sites for community testing. This has really been very impactful in that rapid testing. So these community testing sites, they utilize rapid testing technology that provides the patient a results in about 30 minutes. It allows for a holistic care if a positive result comes out, because there's supporting that result is, patients do receive counseling on how to socially isolate, what symptoms to look out for, how to best connect with the provider. So there's that education piece also. The second piece, which CVS was quick to realize early on, was that there was a huge amount of distrust in the medical establishment, particularly in the Black community. And this was another challenge we sort of started to work to overcome quickly. And in that, was the development and sharing of culturally appropriate information, and then disseminating that information with a partnership with local organizations. So whether with the NAACP or Urban League or National Black Church Initiative or American Lung Association, American Heart Association. So we use all these partnerships to disseminate medical information which was culturally appropriate to the communities at the grassroots. So those were sort of two key pieces as far as testing is concerned. The other piece where the pandemic shed a brutal spotlight was mental health. So I was reading somewhere that 65% of people were concerned about, 65% of Americans between the ages of 18 and 34 had concerns about mental health at the end in 2021, and particularly about their household members or families or friends, the impact of the disease, social isolation and everything. So multiple initiatives here also, and one of them I want to call out is called Here for You. And this was really to address the unique set of challenges of young adults and women in disenfranchised communities that faced during the pandemic. And this program helped connect individuals with peers to facilitate a connection conversation, and also referrals to appropriate resources along their continuum of needs. So it supported this learning about mental well-being, how to build resilience and cope with stress, and then connected them where there was an appropriate need for a certain referral. So I feel like CVS sort of went out on both sides when impacting the mental health. We had a mental health pandemic along with COVID-19, and then also continues to still work on that community-based grassroots testing effort to still continue to mitigate the spread. So lots of learnings there for us as a group and as a company, and multi-pronged efforts there.
If I could jump in and append this, I know we probably got other questions to go to, but
we do. We've got quite a few.
Yeah.
So yep.
Just real quick, I was so impressed. I got to do a couple health hub visits earlier in the month, and seeing health hubs where we actually have mental health. We have LCSWs in the health hubs. Like, talk about bringing it to the community. I knew this effort was underway, but to see that and to see the way the position of the care concierge at the health hub that I mentioned previously, able to interact with patients, with people just kind of walking in, understanding what their needs are, and able to get them to an LCSW right there, is an amazing way to address the mental health crisis. I was super impressed by that, seeing it real live.
All right, thanks so much, RJ and Arpana, for all of that detail around the work that you all are doing. Alexis, I'm going to ask you a question now related to unique community partnerships. So I know you and I both saw, as we were constructing the guide, the variety of partnerships that were displayed in the different initiatives that are profiled. So someone is curious about those partnerships outside of traditional care providers. So which one did you see that was most unique, that addressed working with pharmacies and SDOH?
Yeah, the one that I found to be most unique was pharmacists who partnered with barbershops to reach patients who had uncontrolled hypertension, and to work with the barbershops to build that trust and gain, give patient education and get blood pressure under control and access to medications. I just never even thought of that when I think of community-based organizations and where to go. And what's more exciting is, since we've launched this guide, I've actually found updated results that we can include in a second edition, as well as a second model that was built off of the first one, included in a totally different city. So I'm really excited about that one. And I think it shows promise for expanding those relationships and building the trust in the community.
Okay, absolutely. And Alexis brings up a couple of really good points here too. We're really interested to see how these initiatives evolve and what new initiatives potentially take place as the result of some of the early initiatives. So please, we look forward to continuing the line of communication throughout this year and probably beyond then, just to really build out the guide, to increase its depth, and to really also get to some of the results. Some of these initiatives, you will see that they span the spectrum. Some have very definitive results. Some are really just getting started. And we knew that when we put the guide together, that we were going to display different initiatives that were in different phases. So it's going to be exciting to see how all this evolves. So I agree, Alexis, the barbershop setting was pretty cool. All right, we did have several questions that came through about community-based organizations. So RJ, I know you described in detail the partnership that CVS Health has with Unite Us. So you kind of got into that and how all that works. And you mentioned that the work that you're doing now took a lot of steps to build to get to the phase where you're at now. Do you have tips for anyone in the audience, whatever their setting may be, about how to get that conversation started? Like, how do you start at the very beginning if you might like to partner with a community-based organization?
Yeah, no, wow, great question. It's really about, this is all usually the way things happen. I'll tell you how it happens. Usually one of our business leaders or somebody in the business will come with a need, right? They'll want to do something in a specific community. And then from kind of the breadth and depth of knowledge that we have on the team, we kind of try to solution for that. So maybe not in this example, but it's a somewhat easy example because everybody gets food, right? Like we really wanted to do, our team in South Florida wanted to do something around food, but we also kind of guidelines are, it has to be measurable. It has to be health outcome measurable now, right? Like we used to do, like, hey, let's sponsor something and do some cool stuff. And that was, 2, 3, 4 years ago, right? And so now we've partnered with, this is the hard part. To be honest, it takes at least, Alexis probably pointed this out really well in the guide, Saul, right? It takes at least us and usually at least 2 other partners, right? So in this case, Feeding South Florida is there to provide the food in a what they call the mini mobile pharmacy, FARMACY, that shows up at a federally qualified health center, 2 different locations, or 2 different clinics, 2 locations each, twice a month, for each. So that's a big number of food distributions, right? But it is specifically for, here's the what and how we're measuring and who we wanted to serve, is specifically for members that are both food insecure and have a higher uncontrolled A1C, right? And then so we're measuring a social measure, their change in food security, and we're measuring the health measure, their A1C, right? Over the time of the distribution of the healthy food, which includes things like some of the how to use, right? Some people may be unfamiliar with some of the produce, things like that. So the question is, how do you get started? Like, kind of think about what you want to do and how you want to affect it. what would be some of those kind of controls on some of those levers that you could put on what could control it, and then it's either knowing or going to find the right partners, right? So like in this case, we have the FQHC, we have longstanding relationships with, and also Feeding South Florida, part of Feeding America, who we have a fantastic relationship with. So hopefully that helps a little bit.
Absolutely. Thank you for the specific example. That always brings some color to the situation to really see how that happens in practice. So thanks, RJ. I appreciate that.
Yeah, it's a little harder to talk conceptually about something like that. Actually, I like to go to examples.
Yep,
it's nice to have examples too. Yeah.
All right, Alexis, one more question here for you. So what is your focus going to be now with the guide? So how are you working on additional initiatives that are going to be in future editions?
So now, the first time when we did the guide, we really were focused on the cost of medications, cultural or literacy barriers, and screening for unmet needs. There were a lot of Google searches, primary literature searches that went on around those three, and I will expand to all 7 areas as mentioned, as well as periodically checking on the initiatives that we've included for news articles that have those updated results for the research studies coming out that we know we're anticipating, and being very mindful in how that transition goes to Amanda and the incoming fellow. So that way they know what to keep on top of as well. And then we will work to summarize the new ones and update the existing ones and add them into the guide.
All right. Yes, we're looking forward to all of that this year for sure, Alexis. So Arpana, this last question is for you. And there's a fair amount of detail. I want to make sure I include it all here. It's really related to mistrust, something that you mentioned earlier. So you said that, and we know that that can be a barrier to engaging Black individuals as well as other populations in the services that anyone offers around SDOH. So what's the connection between mistrust and culturally appropriate information? How do you determine mistrust? What solution options do you have for that? And what results did you get, and anything else to share with us on that topic?
Thank you. Lots and lots of nuances in that question. So RJ, please feel free to chime in if I don't cover everything. So I think some of the work that I can talk about is that, early on, we continued to monitor the surveys which are conducted nationally. We conduct our own surveys to really monitor vaccine hesitancy. And monitor the rate of vaccination, particularly amongst underrepresented minorities. So that was something that we had our finger on the pulse right from the get-go, in sort of understanding what exactly is going on and where is it going on. And in that regard, the response was then tailored to be multidimensional, sort of hyper-local, and really leveraging local business capabilities and our presence. In terms of the results, I'll first go there and then I'll talk about a little bit of how we got there. So as of May 2021, 32% of the individuals who received a vaccine through a CVS Health business were from the underrepresented minority. So that was really good to see. And this was an increase, an incremental change. Now, how do we sort of, what were some of the tools to get there? So one was, really proactive patient outreach. So as we did with the COVID-19 testing sites, we used the CDC's Social Vulnerability Index to inform the setting of these retail vaccination clinics and focused on activating stores and communities which are more vulnerable. So in February 2021, we outreached almost 60,000 CVS pharmacy patients, Aetna and Caremark members to inform them of their nearby vaccine availability, help them make an appointment. And we built this outreach based on 11 million text messages, over 600 million emails, featuring messages from pharmacists encouraging the vaccination and specifically addressing vaccination hesitancy. Keep in mind, more than 40% of our pharmacists and more than 50% of our pharmacy technicians identify as people of color. And they have really been front and center and been the voice in helping people understand the safety, efficacy of the vaccine, and overcome some of that vaccine hesitancy. In addition to that, there was, community-based partnerships. There were grants which were given, and maybe RJ, you probably have a better sense of this, but we awarded grants of more than 1.8 million to various community health centers for free and charitable clinics. There was also a grant in May from Aetna Foundation, which is over $1 million, to the Mass General Hospital's COVID-19 Vaccine Equity Initiative. So overall, there were, as I said, it was a multi-dimensional but local, a hyper-local approach in various areas to address vaccine hesitancy and address that mistrust. RJ, I know, do you have anything else to add to that?
I mean, other than kind of, what we went through on how we did the, gosh, sorry for that feedback on me. I guess it's me, but I don't know how, on how we did the initial outreach there. No, I think you covered it really well.
All right, very good. Thank you, Arpana. Thank you, RJ, for joining Alexis and me today. We really appreciated hearing about all your work. Look forward to seeing what's to come. With that,